Rare diseases are characterized by a wide diversity of symptoms and signs. A country defines a rare disease most appropriate in context of its own population, healthcare system, and resources. Where the intermarriage rate is 40%, the rate of rare diseases occur at the rate of 1 in 1300. In order to qualify for an orphan designation, a medicine must meet a number of criteria. Gene therapy offers a cutting edge approach for treating and preventing diseases by altering human genes. Hematopoietic stem cell transplantation, gene modified cell therapies, chimeric antigen receptor T cell, CAR T therapy. Rare diseases are characterized by a wide diversity of symptoms and signs that vary between different diseases and among patients with the same disease. Due to the low prevalence of each rare disease, medical expertise is limited, knowledge is scarce, care options are inadequate, and research is restricted. Despite their significant overall numbers, rare disease patients are often neglected by health systems, frequently being denied diagnosis, treatment, and benefits of research. Common symptoms can sometimes mask primary rare diseases, leading to misdiagnosis and delayed treatment. These diseases are typically disabling, affecting the quality of life of those living with them by causing a lack or loss of independence due to their chronic, progressive, degenerative, and often life threatening nature. The absence of effective cures worsens the high level of pain and sufferings endured by patients and their families. In common words, a rare disease occurs rarely in population, but there is no universal definition. A formal definition helps a nation to identify such diseases that require financial support for the discovery and development of the drugs and biologics. This in turn helps in encouraging the product development, improving the funding for basic and clinical research on such diseases. WHO suggests that the rare disease should be defined as one with a frequency less than 6.5 to 10 per 10,000 people. A country defines a rare disease most appropriate in context of its own population, healthcare system, and resources. In USA, it is defined as any disease or condition that affects less than 200,000 persons. The affected numbers in Japan are 50,000, in China less than 1 out of 500,000 people, or one that has neonatal morbidity of less than 1 out of 10,000. Many developing countries currently have no standard definition of rare diseases. At present, there is very little data on prevalence of rare diseases in Pakistan, but existing statistics indicate a concerning situation. In countries where intermarriages is common, the incidences of rare diseases increases significantly. For example, in Qatar, where the intermarriage rate is 40%, the rate of rare diseases occur at the rate of 1 in 1300. In Pakistan, the intermarriages rate is 60%, suggesting the true extent of the rare diseases is likely much higher than currently recognized. Orphan drugs. In European Union, in order to qualify for an orphan designation, a medicine must meet a number of criteria. It must be intended for the treatment, prevention, or diagnosis of a disease that is life-threatening or chronically debilitating. The prevalence of the condition in the European Union must not be more than 5 in 10,000, or it must be unlikely that marketing of the medicine would generate sufficient returns to justify the investment needed for its development. No satisfactory method of diagnosis, prevention, or treatment of the condition concerned can be authorized, or if such a method exists, the medicine must be of significant benefit to those affected by the condition. Developing medicines for a small number of the patients has little commercial benefits. Therefore, many countries offer a range of incentives. Orphan designation qualifies sponsors for various incentives in different countries, like in US, tax credits for qualified clinical testing, waiver of prescription drug user fee, potential 7 years of market exclusivity after approval. In addition, funding options for developing products for rare diseases or conditions. Developing countries should also consider the rare diseases serious, as they are emotional, social, and economic burden on the nations. As the rare diseases are diverse, various types of cell therapies are used for these conditions. Some notable cell therapies include gene therapy. Gene therapy offers a cutting-edge approach for treating and preventing diseases by altering human genes, providing hope for conditions that previously had no effective treatments. This therapy is used to address various conditions including hemophilia, Gaucher's disease, hemochromatosis, and certain types of tumors. Many rare diseases are caused by mutations in a single gene, which can be inherited or occur spontaneously. Gene therapy directly targets these genetic causes. Glabella, the first gene therapy drug approved in Europe, treats lipoprotein lipase deficiency, a very rare disease showcasing the potential of gene therapy to address rare conditions. Significant progress includes therapies for hemophilia and beta thalassemia, demonstrating the advancements and effectiveness of the gene therapy. Over 40 gene therapy drugs are currently available worldwide, with various methods, including in vitro and virus based therapies, highlighting the global momentum in this field. China has developed its first gene therapy for type 1 spinal muscular atrophy (SMA), marking an important step in global gene therapy landscape. Hematopoietic stem cell transplantation. Hematopoietic stem cell transplantation uses human cells to modulate the immune system or provide critical support, offering a versatile approach to treating various conditions. There are multiple methods of HSCT, including fetal liver cell transplantation, bone marrow transplantation, peripheral hematopoietic stem cell transplantation, and umbilical cord blood transplantation, each with its unique benefit. Clinical practices have shown that umbilical cord blood is particularly effective in treating rare diseases, making it a valuable resource in medical treatment. Umbilical cord blood stem cells have demonstrated significant efficacy in treating primary rare diseases. For Gaucher's disease, HSCT can provide a permanent enzyme source, offering a more affordable alternative to enzyme replacement therapy. There are numerous clinical reports of the successful cord blood transplants for Gaucher's disease, highlighting its effectiveness and potential as a treatment. The approval by FDA in 2017 preventing CMV infection following HSCT has improved the success rates of these transplants, enhancing patients' outcomes. HSCT is gaining recognition and acceptance as a viable treatment option for rare diseases, showcasing its broad applicability and potential to improving patients' health. HSCT is not only used for treating genetic and hematological disorders, but also holds promise for a wide range of other rare diseases, making it a crucial component in modern medical treatment. Gene-modified cell therapies. Conditions like ADASD, adenosine deaminase deficiency, severe combined immunodeficiency, and beta thalassemia. Patients' own cells are genetically modified outside the body to correct the genetic defect and then reintroduced. Chimeric antigen receptor T cell, CAR T therapy. Patients' T cells are modified to express receptors specific to cancer cells, enabling targeted attack on cancer cells. Antibody therapy is a kind of passive immunity. Antibodies play a role by regulating the signal transduction pathways, collecting cells or proteins to specific sites, and then delivering cytotoxic or neutralizing circulating factors.